Hi, so I'm going to talk to you today about the patient perspective on sustainability, particularly in terms of looking at the issue of so-called green inhalers and how we move to decarbonise ourselves. And what I'd hope to do for this is to share the initial learnings that we have and the perception we have from our patient groups, and also talk about an awareness campaign we are planning around this and that we're hoping to roll out in Wales as well. But just some context broadly, which many of you are aware of this, but support us up, but others possibly not. Just context of where we are and why I'm here, I suppose. So respiratory health remains one of the top 3 killers in the UK, particularly in Wales. Over 115,000, I should say, people die every year because of it. And we talk about the burden of lung disease in Wales being about £500 million a year, making it the 4th most costly disease area. And internationally, it's identified, chronic respiratory disease in particular is identified as being one of the leading non-communicable diseases alongside cardiovascular disease, cancer and diabetes. And whilst the pandemic to an extent helped bring awareness about respiratory viruses, actually in some ways has been a massive distraction, taking resources away from respiratory services into fighting that pandemic. And we're now gradually rebuilding this very, very slowly. And we try as much as we can as an organisation to talk about people's real life experiences and lived experiences and quote different people on our posters and billboards and advertising campaigns. And this particular quote from Divin, one of our volunteers, who actually relies on quite a lot of home oxygen and just last month completed the London Marathon with an oxygen tank, which is a massive achievement. We talk about the idea of lung disease being a hidden disability, one that actually that people just look at you and think you look, particularly sat down or seated, you look perfectly well. And there's a massive amount of stigma that goes around that. So a lot of our work is focused on that stigma. And in Wales, in terms of that context, about 314,000 people have asthma, 74,000 have COPD. These are the 2 big conditions we're talking about today. IPF is a big killer in Wales. About 2,000 people have the condition. There's a 3-year mortality on it. So a lot of people sadly die very horribly because of that condition. Bronchiectasis is one of the next big groups. 1 in 1,000 people have it. And sleep apnea is another big one, with 13% of adult men and 6% of adult women having this condition. Often not thinking of it as a lung condition, and just thinking of it as a sleep-based condition, but it is ultimately down to the affecting the lungs. And of course, long COVID, our newest lung condition, now the 2nd biggest lung condition, with 120,000 people and rising with that condition. And to come back to the kind of context of disease burden in Wales, if we look across Europe, we have the highest respiratory rates in Western Europe, respiratory deaths in Western Europe here, with only Turkey being higher if we want to look at Europe as a total. Northern Ireland, England and Scotland are better. And our rates of death are far higher than the Scandinavian countries, about 4 times higher in fact. And that's a useful thing to bear in mind when we often talk about comparing our inhaler use to the Scandinavian countries, which rely more on dry powders. Is that part of the mix, and how does that come into play? So we conduct an annual asthma survey. We have conducted an annual asthma survey for the last 9 years. We ask various people questions about people's basic care and how they live with the condition. And one of the things that we've asked in the last iteration was around green inhalers, what people felt about the decarbonisation agenda. And we asked the question, how would, if you were offered the opportunity to switch to a dry powder inhaler for environmental reasons, would you take it? And yes, there was a clear majority of people wanted to do that, about 53% in Wales. But Wales was actually the lowest of the four UK nations on this question in terms of people's attractiveness to this option. If you take out the don't knows, it's about 2/3 of people actually supporting moving to dry powder and inhalers. But it is interesting actually that there is this a sort of reasonable group of people that don't knows who are sat in the middle, and of course this is just for asthma. So we using this, using our own qualitative data over the years, we do believe strongly that people with asthma support this agenda. But in COPD we haven't necessarily tested it as well. So we haven't asked that big question to people with COPD. Sadly, it was not included in our first annual COPD survey last year. But we do know from our discussions via our helpline nurses, by healthcare professionals, and via our own qualitative work that there is support there, but there is less of it, and there's probably more worry. But we did try to, but in terms of what people were telling us in Wales, I want to pull out a few examples of real people that we spoke to about this. So this woman from Cardiff has asthma. She says that her biggest barrier to switching is her allergies. She was given a DPI, but one puff was one too many in her eyes, so now she's gone back to her Evo Haler. So the idea of the actual dry powder aggravating her allergies being a major concern for her. But switching that, we had a male member of our patient panels, again based in Cardiff, again with asthma. He actually, actually loves his dry powder inhaler, and actually gave a very lengthy answer to the question I gave him, and actually likes the fact that he hasn't got to worry about trying to get the right inhalation from MDI, which is and worrying about spaces as well. So he absolutely loves it. So and is finding it much easier. And that's a perception we have a lot for the helpline, that people do asthma do find it easier. But then we asked about COPD, and we've had one of our patient panel members in Powys with COPD. I mean, she was very supportive of using a dry powder inhaler. She felt it was better for the environment. She was very much on board with that agenda. But when we asked about would she give much support from a pharmacist when she first started using this, the answer was no. But actually, she was fine with that because she'd been using it for quite a long time, and it went well for her. So that was great. But then when we asked another lady down in Cardiff, this person in the south of Cardiff, about the making the switch, she was very worried, and less of an allergy, but certainly talk about feeling nauseous because of it. Again, thinking about the powder effect in the back of her throat. That may be because of a bad technique example, or because maybe she just couldn't cope with the right inhalation due to her COPD. But she did feel, as in many others, actually, even though it didn't work for her, that it should be tried in the first line for other people with COPD, because we should all be doing our bit. And that's an interesting perspective. Even people who find that they don't think a DPI works for them, they do get the idea of the environmental benefit to us all as society, and why we should do more. So that was interesting insight. So what we're doing on this, so we are currently running a project in England, funded by NHS England, in fact, which we're hoping to roll out in Wales after we've gone live in England and has been fully evaluated. And we've been brought in to essentially find ways of communicating the needs, communicating the benefits of making switches to people, particularly hard to reach communities, and helping provide that patient insight that the NHS need. And because of the nature of the system there, they were happy to actually commission a charity to help with that. I mean, this is hard to read on a very small screen, but in summary, what we're hoping to do is ultimately, the outcome we want to do is ultimately get better health people with inhalers, and obviously get have a lower environmental impact from inhaler usage. We're going to do this by developing our awareness campaign, focusing on making the right choices in terms of dry powder versus MDIs, but also better use of inhalers, more reliance on preventers rather than relievers, and obviously inhaler technique is really important as well. And the specific inhalers we're looking to try to pull out here is again focusing on the preventative medications in the first instance, disposing of inhalers properly at pharmacists, to take on the last presentation as well, and making sure that the people get a regular asthma review and are trained by healthcare professionals. So these are all behaviours we want to embed. And our premise has been to divide the population into 3 specific key audiences, which I'm going to explain more shortly. Disadvantaged, disengaged audience, which has been a key audience for this group. people who are not managing their condition well, don't realise their care systems could be improved. They may not speak English as a first language. They are potentially digitally excluded, which is a big problem for a lot of the work that we do as a charity. And maybe are really struggling because of cost of living as well. We have the engaged audience who are probably the swing voters, argue in this one, who actually are interested in their lung health, but not necessarily interested in the environment. They're engaged with us and engaged with the NHS, and they're very motivated, but they're anxious about making changes. And we had there was a small, passionate group of environmentalists who are the ones who obviously we're trying to get everyone to try to mimic, but they're the ones who are really, really behind this agenda. This is their priority, predominantly younger, predominantly with asthma rather than COPD as well, but very, very motivated. So these are our target groups. So we went out, particularly at the disadvantaged, disengaged groups, to try to get some insights what they were telling us. And we commissioned a company called Britain Thinks, who use quite a few times different projects. And they're very good at helping us reach harder to reach communities and asking very challenging questions, and then reporting it back to us in an anonymous way. So we conducted 33 interviews as part of this qualitative piece of work in a range of different deprived communities. What they told us was that most people from these communities didn't really know what inhaler they were using. They weren't really sure what was a preventer, what was a reliever. They were thinking solely about colours, maybe a brand name, but colours often. There were very low expectations of quality of care. People just accepting that actually my asthma is bad, my COPD is bad, this is my life, and it can't possibly be improved. There was a sense that actually pharmacists and respiratory asthma nurses were possibly the best way of getting into these people. There was quite a high use of high recognition of these roles, and actually we were pleasantly surprised that there was quite a lot of understanding about the roles of spacers, bizarrely, which actually was completely defied our expectations. So it was quite mixed, but low digital engagement, and actually we struggled to actually engage with to find people with COPD from non-white communities as part of this work. So that was mainly a disadvantage rather than English as a second language there. But it painted a picture of the challenges that we face. So what we want to do by using this information is try to build our information depository around this agenda and build an education that works for people. So we're looking to try to put together resources that some are universal, so universal messages around how we use inhalers, how we manage asthma and COPD care, focusing on videos, storytellers, real life experiences in our messaging, but looking at specific messages for certain people. So we're going to have health advice focus on the environmental impact, but that's really going to be for the environmental audience predominantly. We recognise that this engaged, disinterested audience, if they are online, actually we don't need to bore them with lots of words, and therefore we focus on animations and keeping it simple as possible. And the engaged audience, we know, will focus more on our normal health advice. We need to focus our messaging around changing medications rather than thinking about the green inhaler agenda, but ultimately it's all doing the same thing. Actually, I've already covered that one. So what is the messaging? So what are we trying to say to people? So for our environmental audience, we're going to be focusing on the environmental benefits of inhalers, obviously, making that very clear, but also focusing on the plastic agenda, as previously been mentioned as well, talking about the disposal issues, pushing the disposal schemes we have here in Wales, where we have recycling schemes, and where we don't, the safe disposal ones back to pharmacy, but also pushing the risks, the actual environmental risks of poor inhaler technique, the wastage, the cost, and therefore the environmental burden of that, as well as the impact on individuals themselves. So our messaging will be, we focus on change inhalers if you can, with the support of healthcare professionals, return inhalers to a pharmacy, and improved inhalers benefit the environment ultimately. And we're going to be, we want this audience to remember, crucially, by taking simple steps, wrong button, they are playing their part, an active role to reduce carbon emissions. So what about us? What about the difficult, really difficult, disengaged, disadvantaged people? So we need to recognise that the understanding of different inhalers is low, as mentioned before. disposing of possibly the only thing they might well have engaged with from an environmental point of view is disposing of inhaler at the pharmacy, but very few of them. That actually the health-related benefits and effective asthma and COPD care is probably the most important message here. And whilst arguments about positive environmental impact are supported, they're not necessarily with the thing that's going to shift behaviour. But crucially to recognise here that healthcare professionals are a trusted source and the preferred way of actually communicating with people. So our key messaging for these people is that by doing this gender, they will feel better and they deserve far better care. So what this audience take away, by taking simple steps to manage their condition, they could save money and time and feel better too. What about our swing voters, our disengaged supporters, as it were? So we want to make sure we're conscious for this mission that people that actually want to manage their stress and anxiety around inhalers. They may have gone through several different types of inhalers over the last few years to get to an asthma or COPD care which works for them. So therefore they are worried about potentially changing. We know that this group of people using inhalers effectively is really important to them. So therefore, inhaler technique needs to be pushed more and more. And we know that they respond well to managing and venting symptoms. This is their key kind of message and area. But they also understand the benefits of simplifying inhaler usage, because actually they want care and support that works for them. So our key message to this audience is focused around improving their technique, preventing and managing symptoms, and feeling better. And our messaging and what we want them to take away from this, that by taking simple steps, they could improve their symptoms and ensure that they're managing their condition in the best possible way. And we're not going to jeopardize that by changing their inhalers. So this is nice to have a summary of those key messages on there, but please forgive the colours. They are quite bright. So that's our campaign. So where we are with that at the moment is, as I said, it's being funded by England, it has to be rolled out in England first, but we have discussions with the Welsh Government, with Scottish Government, with the Northern Department of Health about how we use this messaging to help them push this messaging campaign here. And there's a lot of interest for it. So we're very keen to make our resources as available as possible once we've launched them and can do that. So the take-home message from me is that there's a lot of support for people with asthma to support the principle of moving to DPIs and improve the environment. There is less support for people with COPD, but even with that support that we have, we can't take it for granted. We need to work with people and reflect that everyone is different. We need targeted messages for different audiences. One size fits all approach will not work. And actually, we may well find that even our three message approach needs to be more nuanced in some cases. But we be very careful about who we target messages with and what we are saying. And we need to focus crucially on the benefits to patients as well as the planet. As I think what we often find is that no matter how altruistic we all might be, ultimately, if someone's living with this chronic lung condition, and in the case of asthma, it may be for decades and decades. In the case of COPD, it still could be over a decade. This is the primary thing that's been resonating with them. So we can focus on the patient benefits as well as the benefits to the planet. So by doing that, we can all benefit the planet, reduce emissions, and have better asthma and COPD care. So thank you for having me.